On this week's episode, we're going to be talking about different adjustment techniques. I'm with Dr. Mike today, and today we're going to be talking about different types of adjusting techniques.
Yes.
A lot of people probably don't know that there are different ways to adjust patients. What are the different types of adjustment techniques?
So in the office here, we do a combination of like 3 to 4 different techniques. All the techniques are named after different doctors that made them up, and we do kind of a congregation of all of them, based on individual person, what they come in with. Gonstead, Diversified, Thompson, and Activator are the 4 main named techniques that we utilize here in the office.
Okay, so what are the differences?
So some are lighter force, some are a little more of just a straight up manual adjustment based on individual patient need. We get some people that come in asking for a specific technique if we do it, and that's why we're skilled and use multiple ones so that we can accommodate multiple people.
Okay, so if I were somebody who was unsure about chiropractic care and I came in and I was kind of really nervous about being adjusted, I guess, in a hard way, what different method or what type of method would I use?
So lighter force techniques, there's 2 that we use. One is using the drop tables. So later on when we show an adjustment itself, I'll talk a little bit more about that, but the table themselves actually have a drop mechanism where it pops up, drops down, making the adjustment versus a full-on manual adjustment. Lighter force way of doing it specifically for the lower back is where we tend to employ this. The other is going to be the activator method. So using this handheld little tool, gives a little impulse affecting at the muscular and joint level to help make that correction.
Okay, so what are the benefits of them all individually for each person? Is it just dependent on their I don't even know, them feeling comfortable with the adjustment, or is it more like injury based?
A little bit of both. So certain techniques affect the joints in certain ways, others affect them in other ways. And so like the drop table is just simply for what we call posterior adjustment, so back to front. Lower back stuff, we do a little bit of what's called a side posture, so that takes out a little bit of rotation, and then same with the neck, we work on rotational type issues, but it's really just like individual person dependent. If I get a really elderly individual that comes in, I'm not going to adjust them the same way that I would adjust somebody like yourself.
Okay, so it could be age dependent.
Absolutely, yeah.
Alright, so up next we're going to actually show these different type of methods that we do use in the office. Dr. Mike is going to work on me with these different type of techniques. Rainey's Fitbit is up next.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week I'm going to show you a on-the-go workout that is perfect for the holidays since Christmas is coming up. So this is perfect anytime that you're traveling or just don't have time to get to the gym. The only piece of equipment that we're going to use is a resistance band. If you don't have one, you can purchase them at like any store in the sporting goods section. They run pretty cheap. Alright, so what I like to do here is circuit workouts. So we're going to do a full body circuit workout. And the way that I like to do this is I've taken 6 exercises and we're going to pair 2 at a time, and we're going to do 3 sets of 10. So we're going to go through and we're going to do 10 reps of each of them, but we're going to keep them in pairs, and we're going to do 3 sets. So first we're going to do the squat, we're going to do 10 of those, then we're going to do the bicep curl, we're going to do 10 of those, and then kind of repeat back and forth until we've done 3 sets. When you've done that, then you can move to the next couple, do it the same. When you're done with that, you move to the last 2 and do it the same. All right, so I'm going to show you kind of what I had in mind. Doing a squat with a resistance band is a little different. So what you're going to do is step kind of like towards the middle, but you still want your feet at a good distance so you can still squat, so about hip width apart or so. You're going to bring the handles up towards your shoulders like this, and then you're just going to squat basically. So sitting and standing again, pushing your hips back, keeping your heels down. If you don't have a resistance band, you can do these just air squats, or you can even use a chair and do chair squats, the same. But again, so I'm doing 10 reps, all right? Then we're moving to the bicep curls. So for this one, you just stay standing on the band, just like this. And then you're going to curl the handles up towards your shoulders and then down. So just doing 10 of those, like that. And then again, I go back to the squat, 10 until I've done 3 sets. All right, so the next set is, or the next couple of exercises is the reverse crunch and the seated row. So I'm gonna get down onto the floor for these two. A reverse crunch, we're gonna be working on core. So you're gonna lay back. This is kind of like a leg lift, but the more straight your legs are, the harder it's gonna be. So we're gonna just start with our knees bent. I'm going to lift the knees towards the chest, kind of picking up my hips at the top, and then resting them back down, like that. Again, we're doing 10 of these. Also notice I'm only bending through the hips. When I do this one, I'm not bending through the knees. Keeping the knees at the same angle, and then only going through the hips like that. All right, and then the seated row. Again, we're gonna use this resistance band again, and I'm gonna put it under my feet like that, keep my legs straight. We need more tension in the band for this one. It's typically easy if you're holding it way back here at the handles, you're not getting much resistance. So I'm going to move my hands closer to my feet like this, and I'm gonna pull it back, and then kind of like rest forward, pull it back. Basically what I'm doing is squeezing my shoulder blades together as I pull back, and I'm working those muscles that are in my upper back. So again, you do 10 of these, and then I go back to the reverse crunch, back to the row until I've done 3 sets. All right, then the last couple of exercises are the tricep dips and the split squat. So for tricep dips, you need like a bench or maybe a couch or something. I'm just gonna use this box today, but you're gonna sit first, keep your hands next to you. So what we're working on this one is your triceps. Keep your hands next to you like this. You're gonna kind of like move your butt off of whatever it is that you're sitting on. And you're going to basically do kind of like a reverse push-up. So you're bending the elbows down, relaxing, taking your butt towards the ground, and then pushing yourself back up. So down and up, like that. This is kind of like the modified version, is to keep the knees bent. If you want to make it harder, straighten the legs and then do it that way. All right. And then the last exercise is split squat. This is similar to a lunge. So for this one, you're gonna split your feet, one in front, one in back. We're gonna bend at both knees. So I'm taking the back knee towards the ground and then standing up, down, up. Really focus on keeping the heel of your front foot stuck to the ground. We don't want you going up on your toe and causing a lot of pain in the knee. So make sure that you keep that heel down so your knee stays right above your ankle. So you're just going down and up. Again, you're doing 10. Then you'll switch and do it with the other foot forward like that. If you have trouble with your balance, just hang on to something. Try not to push yourself up with it though, just hold it for balance purposes. All right, so again, perfect for the holidays, perfect for traveling. Again, I recommend doing 3 sets of 10. If that is too much, modify it to do 2 sets of 10, whatever works for you. All right, so that's been this week's Fitbit, and we'll see you next time.
Okay, so we're back. Dr. Mike is actually going to show me just all the different techniques that we discussed in the beginning. I think we're first going to start with the drop table, and then he's actually going to walk us through the benefits and kind of the whys behind we adjust differently here.
Yep. All right, so face down. So Brooke is currently a patient of mine, so I've done my typical exam on her to figure out what's going on, my full chiropractic exam, and so demonstrate a couple different techniques that we do here for the adjustment. So example of the drop mechanism is, so I'm going to work on her pelvis a little bit here. Table's going to come up underneath her. I'm just going to give her a little push. And as the table drops out, with the push that I'm giving, that's where we're getting the correction. So basically just trying to free up her pelvis and get a little bit more motion into the lower part of her pelvis here. Come on up through the middle part of her back here, and I'm going to demonstrate a couple different methods here for working with the upper back. And so the first one I'll do would be the activator that we talked about, that instrument assisted. Come on both sides of the spine. And then rechecking to make sure we're getting the motion that we're looking for restored into that upper part of her back there. As we work a little bit further up, I'll show just kind of our regular manual adjustment, hand adjustment for the upper part of the back here. Starting to work right just a little bit higher there. So take a big deep breath in. All the way out. Just give a little push. Good. All right, laying your right side, so face over towards me. So next I'm going to demonstrate what the side posture adjustment is going to be. And so the drop mechanism, like I said before, is really good for that just straight posterior to anterior, working straight on down. When we get some rotation, especially in the lumbar spine, this is where we're going to have a really good effect with the side posture adjustment. So I'm going to find my area to work on. Just let it nice and relax. Roll it with me and just give a little push. That's it. All right, come up and have a seat at the table. Just put my feet around that way. Last time I showed a cervical adjustment here, so this is a seated cervical adjustment. In a different episode, we showed a supine or laying face-up adjustment for the neck, but today we're going to work on Brooke's neck in an upright position here. So find my spot here, and so just let that nice and relax, and bring it to the side. Recheck my spot there. There you go. That basically outlines the different techniques that we do, starting from the bottom all the way up. We can employ all those different techniques for all of the areas of the spine. That was just kind of a congregation of kind of all of them in one. Don't typically do that, but we do have all those in our toolbox that we can use.
And like you said, sometimes it's a patient coming in requesting that specific kind, but the majority of the time you're actually providing the suggested.
Yes, absolutely. Yeah, some people, even the ones that come in requesting a certain type, I figure out the why and the where. Why they want to do this technique. Have they done it in the past? Is it a comfort thing? Is it a safety thing? All the different techniques that we have are effective for pretty much anybody in any shape or any condition.
Awesome. Thanks, Dr. Mike.
Absolutely.
So that concludes this week's episode. We will see you next week.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.